Zazalapa. My name is Ruskhana Kapali. I am 22 years old trans woman. I work for transgender rights in Nepal. First of all, transgender and non-binary people were already marginalized in our societies, and the pandemic further, increased this disparity and further pushed them into further vulnerability. Talking about healthcare services, transgender and non-binary people already face discrimination. Hospitals in Nepal are usually not segregated on basis of gender, but a lot of quarantine facilities were segregated on basis of gender. So for example, for a transgender person to be able to access quarantine services were very difficult. Similarly, the government started providing relief packages to everyone, basically prioritizing those who were most vulnerable. Apparently, transgender people were not included, or the government didn't think that transgender and non-binary people are also one of the most vulnerable populations. And the government mandated that anyone who has to access these relief services need to provide their citizenship. Transgender people are not able to, acquire citizenship or basically amend their citizenship to reflect their gender identity. Due to this incongruence between their lived gender and their documentation, a lot of transgender people were actually being denied from accessing relief packages. During the lockdown, everything was shut down and the government only allowed essential services to run. For example, for a lot of transgender people who are going through hormone therapy, or a lot of transgender people who had gender confirmation surgery, hormone therapy is a very essential need for their physical, for their mental and social well-being. And during the lockdown, all of these services were not seen as an essential services. There were 20 reported cases in Nepal of transgender people who had committed suicide. They had left their families, they had left their houses, and they were living separately with their friends or alone by themselves. But during the lockdown, it created circumstances that they had to move back to their families, where things were not accepting, where they were not embracing of their gender identity, and therefore we had around 20 cases of transgender people committing suicide past year. The very reason that in the past year's lockdown and the way government of Nepal has been taking measures to deal with the pandemic has not been able to address the needs of transgender and non-binary people, include transgender and non-binary people at the decision-making levels, at the policy-making levels, and at the spaces where they're making decisions about how to deal with the pandemic. The first step to helping the LGBTIQ community or the trans and non-binary people in Nepal would be to reach out to us, to hear our voices, to listen what we have to say, and to listen what we are experiencing. Understanding the ground reality is very essential for anyone to extend support to us.